It's my pleasure to be here at Fundació ACE in Barcelona, and I'm here with my colleague, Dr. Octavio Rodriguez, a neurologist, and I'm also here with Dr. Josefina Melendez-Cabrero, a neuropsychologist who oversees the Alzheimer's Prevention Clinic and Research Center in Puerto Rico in research collaboration with the Alzheimer's Prevention Clinic at Weill Cornell Medicine and New York Presbyterian. Octavio, it was a real pleasure to host you this past summer in New York. Aside from going to a Yankees game where we had a lot of good times and the Yankees won, which was good. We also got some great work done together, and it was really a pleasure for me and our whole team to have you contribute to our program. I wanted to ask you, as a neurologist visiting from Barcelona and working in Fundació ACE, tell me about a brief overview about what was your experience like? Maybe what did you learn from your time in the clinic?
The pleasure is mine was mine to be there for these 6 weeks, and it really was a very good experience for me because your clinic is a very innovative concept. We have no Alzheimer prevention clinics in Spain, neither in Europe, to the best of my knowledge, and I got impressed by the concept of precision medicine, that is to study the different risk factors of each patient and develop a treatment plan or prevention plan individualized. So it was a very good experience for me. I learned a lot.
Great. And in terms of for people that may be watching, healthcare providers, physicians of multiple specialties that may be interested in taking care of a patient and trying to reduce their risk for Alzheimer's, what is do you think is the biggest challenge for a physician out there or a healthcare provider out there that wants to try to see patients and try to help them reduce their risk? What's the biggest challenge?
It's difficult to answer this question. I think that the biggest challenge is the society, to change the mind of the society, to the people in the community needs to understand that Alzheimer's disease is a preventable disease to some extent, and a lot of people don't know that, and even a lot of physicians don't know that. So I think it's our mission to share this knowledge with all the community and all the physician community. This is the biggest challenge, I think, to change the vision of the population, the physician, and of course the policymakers.
Yeah, absolutely. So, Josefina, about a year ago, you contacted us through email, a little over a year, and then now for the last several months, you've been up and running, just getting started with your program in Puerto Rico. What's been the most rewarding aspect, and what's been the biggest challenge of trying to see a patient and also try to maybe reduce their risk?
It's been a very good experience patient-wise. The families, once you explain to them how everything works, how the risk factors work, and the model, especially the individualized plan, they understand and they want to take charge of their health. Challenges are, as Octavio said, mostly by society. Many physicians don't know what to do. If the patient says, "Oh, I think I have a memory problem," they just say, "Oh, that's normal aging," and they just don't know what to do with the patient. So that's a challenge, and I think the most important thing is education. We have to educate the society, the physicians, the politicians, everyone, because there's just an awareness of how to treat this and prevent this.
Great. Okay, well, hopefully we can reconvene here, whether it's in Puerto Rico or New York or Barcelona.
Yeah, next Puerto Rico.
Yeah, next time it's Puerto Rico. We can reconvene, and we can, aside from having data from our clinic, we just presented new data on 168 patients after 6 months, and we were able to show that patients were not only reducing their risk of Alzheimer's disease and dementia across multiple risk scales, but also cognition was improving, and even lab biomarkers of risk were also improving. Hopefully we can not only show that in our population, but we can show that in Puerto Rico and in Barcelona, and show that this model really works across the world.
Yeah.
So looking forward to San Juan.
Yes.
Okay.
Thank you.
Thank you.